China reeling under a surge of COVID cases as it is plagued by the spread of the new BF7 Omicron variant. On the other hand, the US Centers for Disease Control and Prevention, the CDC, said that the Omicron subvariant XBB accounts for 18.3% of the COVID-19 cases in the United States for the week, which ended in the 24th of December. Now, caseload increases in other Asian nations such as Singapore as well, and India has stepped up efforts to combat a possible resurgence of the virus. Joining us, we have Dr. Sandeep Buddhiraja. Now, he is a Group Medical Director in Max Healthcare. He's here to talk us through how and what the response to this dynamic situation is and what it must be. It's also important to note that he was also honored by the Delhi government, and he is the one who had started plasma therapy in Delhi as well. Thank you for joining us, Doctor. Now, first of all, what is the main concern here? There are several variants now that are also spreading towards Asia in countries like Singapore, some coming from the US. Of course, China's variant is causing chaos. What is the main concern for India here, sir?
So the main concern for India is that, being a part of the global if there's an outbreak in one part of the world, there is a likelihood that the infection starts spreading elsewhere also, and India might not be spared. So the concern is that we are seeing unusually high numbers happening in China. Will that spread to India or not? So that's a concern, and that's a very valid concern, and we as a country should be prepared to handle that situation. Although I do not think, and talking hardcore science, based on facts, I do not think that the situation, what is presently happening in China, will happen elsewhere in any part of the world, and more so in India. So that way, I don't think it's a panic situation. We just need to be prepared to handle if increased cases happen. But clearly, why I'm saying the situation is not going to be same as in China is because our population has behaved very differently. The vaccination status of a country as a whole is much better than that of China. The vaccines have been more effective. And Indians have had exposure to multiple infections over the last 2.5, 3 years, which Chinese were not. Because of their zero COVID policy, they were completely in isolation. So it was a very naive population in China, and their immune status in terms of immunity against COVID was very poor. And that's not the situation for us in India. So I don't think we need to really panic or be afraid of anything, but yeah, I think a guard and a caution at this stage is important for us.
Right, Doctor, could you help us understand the XBB subvariant of the Omicron and also the variants that are coming out of countries like China and then spreading to countries like Singapore?
Yeah, so three variants which are being spoken about are XBB, BF.7 and BQ.1. Now, these are subvariants of Omicron. And as you know, Omicron struck the world December, early January this year, 22. And what we have seen is, fortunately, the disease is mild, especially if a person is vaccinated or has had a prior infection with COVID. But all these new mutants which are emerging are highly infectious, highly transmissible. They have very low incubation period. That means they can, over a very short period of time, infect a large population, even if the population has had prior vaccination or infection. So that means they have a phenomenon, what we call as an immune escape. Now, that fortunately does not translate into making these viruses more fulminant, more virulent. So the disease they cause, especially if they are attacking a population which is already has a good immune status, is overall mild. So we may talk about all these names of mutants of Omicron, but ultimately at the ground, most of them behave more or less in the same fashion. And in fact, presently for the last several months, what we've been seeing is it behaves like a sort of a simple viral flu. Person will come down with fever for 2-3 days, headache, body aches, cough, cold, maybe some diarrhea and most of the things. Elderly, susceptible population are at a higher risk. But even at Omicron time, when it first struck us, we saw that the overall rates of hospitalizations, the severity of disease, mortality was much, much lower than what we experienced in Delta wave, especially at a time when the larger population was unvaccinated. So I think in terms, these are all names of mutants, and virus has to survive. In order to survive, it will mutate. And it will mutate more in a population which has better immunity because the virus needs to turn around and find ways of surviving. So all these mutants have very high infectivity, but fortunately, they are no more severe than what we have already experienced in past.
Right, Doctor, now what the Union government is doing is, of course, the Health Ministry is then carrying out tests at airports. They're ensuring that genome sequencing is happening and the coordination between state and union governments is clear and the system is set. They're, of course, talking about hospital infrastructure, ensuring there is enough resources in hospitals. These things are being done. Citizens are also being asked to take precautions. But what more do you think should be done, or do you think there is anything more that needs to be added to this precautionary measure that India is taking, as of course our neighbors are now struggling with several of these variants?
I think these are just the right steps which our government has taken, increasing the surveillance and most importantly stepping up the genomic sequences, which not only in India, I think world over had sort of slacked because the numbers were extremely low, but that is something which we need to now push up, because genomic surveillance, genomic sequencing is the only way by which you can detect which is the more prevalent viral strains or the mutants presently in your country, and take action of prevention, isolation, treatment accordingly. The second thing, which I think is something which we must emphasize, although our vaccination program has been one of the best in the world, is that the third dose or the precautionary dose, as we call in India, needs to be reinforced, that the eligible population should be encouraged to take it. So our people who are vaccinated against the first two doses, the primary course of vaccination has been extremely good. And a large population has already experienced infection. So that also acts as a natural boosting. The latest survey which showed the national seroprevalence was in almost 70%, 65% or so. So that means the population at large is largely immune. But I think still people who have not taken their third or the precautionary dose must be encouraged to do so now, because that will boost up your immunity. Although there is no assurance that vaccination will prevent you from getting an infection. But what is more important, that if you get infection, if you are fully vaccinated, your disease will be much less severe. And in all likelihood, you will avoid hospitalization and the virus just behaves like a flu. So I think, the next thing is the COVID appropriate behavior. So I think it's time again, we need to be more careful about where we go, avoid going in very crowded places. Even if you have to go into open public spaces or closed spaces, please wear masks, maintain social distancing, hand wash. What we've been talking about the last 3 years, I think now needs to be reinforced. And people need to remember that the virus is still there, and these simple things can prevent you from getting infected.
Right. Doctor, you spoke about the precautionary dose and the booster dose and how that is important, of course. Now, the intranasal vaccine also has been approved. If you could tell us a little bit about the innovation that goes in there. Of course, there is no comparison. All the vaccines that India has produced and is using are good. But of course, help us understand the significance of the intranasal vaccine, so people who may be interested to take that have full understanding of what it is and how it works.
Yeah, so that's just recently been approved by Government of India as the vaccine which can be added. And in fact, it's a heterologous vaccine. So that means if you have taken, earlier what was happening is if you have taken Covishield, you have to continue taking Covishield. If you have taken Covaxin, you have to take Covaxin. Now, this is a heterologous augmentation. So if you have taken, whether you've taken Covishield or Covaxin, the third dose can be taken by this, the intranasal vaccine. It's in form of drops. 2 drops are to be taken. And in fact, what we have seen in past from lots of studies is this heterologous augmentation. That is, you swap between the vaccines for booster, gives you a better immune response and a longer immune response. So in that way, it will be good. And the other most interesting part of this nasal vaccine is because it is delivered through nose, so it gives you a local it gives you a local immunity at the site of portal of entry. So theoretically speaking, this is one vaccine. We've been saying that even if you are vaccinated, you can still get infected. Now, theoretically speaking, this is one vaccine which can significantly reduce the risk of a person even getting infected, because at the portal of entry, you are creating a local immunity. Now, that's obviously theoretical. Now, how much that relates into a practical situation can only be seen once there is a mass usage of this vaccine, intranasal vaccine, and obviously it is without any injections. So that way it is easier to administer. Logistically, it's easier to give it to masses. So I think it is something which India can showcase to world how a nasal or an intranasal vaccine can alter the course of COVID outbreak. So I think we need to, it's early days, we'll have to wait for the results.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.